to use, if it's alcohol, if it's mirais, because everywhere was closed. And we witnessed a lot of cases of gender-based violence back then. And most of them were attributed to substance abuse.
Thank you so much. I would want to contribute a bit about the use of around drugs, or the drugs that we use. They are drugs because they affect our brain, but they are around, like alcohol, like cigarettes. They have an impact, yes. But these are the gateway drugs. As Prof has said, our young ones admire their fathers, admire their sisters, admire their neighbors when they are taking them. So they experience, they see and observe how they feel good, how they feel high. And this is what informs them on the choice. Then coming to the impact of these drugs, when I talk about gateway drugs, I'm talking about when you get to using like cigarettes, you are a likely candidate for cannabis. You are likely candidate for all the other drugs, including heroin, cocaine that is on high use in our country, according to the study I did. What is the impact of use of this at family level, and even at the individual level, school level, and our community level? That's what you want. So the impact is this. Once we are on drugs, we call them psychoactive drugs, meaning they affect the way your brain works and behaves. Once you are in it, your emotions are likely, you are likely not be able to regulate your emotions. So you are likely to be violent, unlike when you are not using. You are likely not even to make decisions, meaning when you are violent, you can now fight or rob. Then there is also the issue of relationship in the families. When somebody is in drugs, one of the greatest impact is the relationship in the family. And this is also what leads to gender-based violence. In terms of maybe the husband is being told that, why are you using this? And that there is no money, there is no food. Then the husband will respond by fighting. So there's a lot of fighting. Parents also are not able to know how to handle this. So they are fighting with the kids, their children who are in drugs. So there's a lot of fight within the families. There's a lot of misunderstanding. The relationships are not okay. To the community also, there's a lot of impact on drugs. There is no productivity, because most of these people who take drugs and they are in the addiction level, they don't work. So that's not another great impact. There's no productivity amongst our people. And then what is the impact in the overall government? There's also a lot of money being used to treat the same behavior. Economic wastage, which would have been prevented through advocacy and preventive measures. Thank you.
Prof, I believe whatever the doc has talked about quite resonates. We are looking at a situation where